speaker is Dr. Tanmoy Vaidya. His topic is, can we improve the performance of extended depth of focus intraocular lenses?
Yes. A very good morning to all of you. I'm Dr. Tanmoy Vaidya from Narayan Netralaya. So my topic is, can we improve the performance of extended depth of focus IOLs? No financial disclosures. So near vision correction forms the holy grail of today's refractive cataract surgery, where every patient wants spectacle independence and optimal near vision correction. So these are the choices we have as a surgeon.
Doctor?
Trifocal IOLs do give very good outcomes
I
in
don't
these
know
patients,
that,
but the issue is the patient suitability and the issue of glares and halos. So EDOF IOLs is the next choice. These lenses work by creating a single elongated focal point to enhance the range of vision. They give very good distance vision, but the issue is suboptimal near vision. So how can we improve the performance? Monovision, micro-monovision strategies have been used in these patients with good results, but at the end of the day, we are compromising on the distance vision in one of the eyes of this patient. So can we correct them with myopic astigmatism? This is basically based on the Sturm's hypothesis, where two focal points are created and a focal interval is there, and as long as the retinal image is clear, the patient's depth of focus increases. Another option is by modulating the spherical aberration profile. Multiple studies again have been conducted with variable results, including one of our own. The issue is all of these studies have been tested on monofocal IOLs. So we at Narayan Netralaya aim to assess the improvement in near and intermediate visual acuity in these EDOF IOLs by inducing the spherical aberrations and myopic astigmatism. These EDOF IOLs are comparatively more forgiving due to their broader landing zone. The main goal of this study was to have minimal or no effect on distance vision. So we did a prospective observational studies where 80 eyes underwent uneventful phacoemulsification by a single surgeon. 40 of these eyes underwent Vivity implantation, whereas 40 eyes underwent IHANS implantation. Now IHANS, is strictly speaking, is not an EDOF IOL but a monofocal plus IOL, but it does have EDOF characteristics. The first arm was to induce optimal spherical aberrations. The patient's refraction post-operatively was checked by an experienced optometrist, and the distance corrected visual acuity was considered as a baseline to test on the visual adaptive optics analyzer, aptly named WOW. So this is a machine which is based on the Hartmann-Schacht aberrometer, where it can also where you can view and modify both the visual profiles, including higher order aberrations. So here, the spherical aberration was modulated at steps of minus 0.01 microns, and the distance corrected visual acuity was retested for all these targets. The median optimal SA for both of these IOL groups was minus 0.05. So this optimal SA is basically the near and intermediate visual outcome without worsening the distance vision. So defocus curves were tested for each of these patients yet again. So as you can see, the intermediate and near vision improved marginally without really compromising on the distance vision in both the dominant and non-dominant eyes. So a similar experiment was carried out by optimizing the cylinder. The similar process was carried out on the WOW machine. Here the optimal cylinder was taken by inducing a convex cylinder in these patients and making the patient myopic astigmatism. So the optimal cylinder again is at which the near and intermediate visual acuity improves without compromising the distance vision. These were the median values for the same. So each patient's optimal cylinder value was taken, and the defocus curves were retested. Now very interestingly, the near and intermediate visual acuity improved significantly, but the only problem was that the distance vision was compromised monoocularly. So we went ahead and repeated this experiment binocularly, and as expected, the patients tolerated it much better. So as a conclusion, inducing a negative spherical aberration led to a significant statistical improvement in both the groups in the near vision defocus curves. Most of these eyes actually accepted a minute spherical aberration correction of minus 0.05 microns. So this shows that the EDOF designs was already optimized significantly. So as shown, the cylindrical profile can be altered but is tolerated better binocularly. So as we know that the EDOF IOLs provide good distance, intermediate and functional near vision, and SA profile alteration and myopic astigmatism can be strategies which can be used to improve it. So this can go ahead further when we personalize the treatment for every patient And instead of using a blanket spherical aberration or a cylindrical profile, we can customize these treatments and optimize the outcomes. Thank you very much.
Good, very nice. Dr. Aruna, can you do add?
So very innovative. So which machine? This machine is from which
So
company?
this machine is from Voptic as the company, and it's the visual adaptive optical and adaptive optics machine. So you can actually input the spherical corrections, cylindrical corrections. You can change the higher order aberration profile, where you can induce coma in a patient, where you can induce spherical aberrations and retest it.
You have induced spherical aberration in
Yes,
one
yes,
experiment.
ma'am. Spherical aberration first, and then the cylinder.
Good presentation, Tanmay. Just want to know why you compared with the IHANS lens. Why not just the monofocal?
Ma'am, actually the monofocal lens, the study has already been done by us. With the monofocal lens, the negative spherical aberration profile and the cylinder profile is not really optimized by the companies. So compared to that, the IHANS has already got a negative SA aberration of minus 0.27. So where it has an EDOF characteristic, but it's not really characterized as an EDOF lens because there's a drop off in the near vision acuity. So it's a comparable.
Can you, maybe you could have had a third group with just the monofocal?
Yes, ma'am. So we are planning on comparing all the three groups, monofocal, EDOF and a trifocal IOL in the future.
Okay, thank you.